Joining us now, the Secretary for Virginia of Public Safety and Homeland Security, Brian Moran. Mr. Secretary, good to have you back, sir.
John, nice to be back with you. And further example, there's something going on in the news every day. It keeps you hopping. But I really appreciate you having me back, and good to be with you this Friday morning.
Well, we never seem to have a lack of things to talk about here in the morning. There's always something going on nationally, globally, in Virginia. Now, I just want to start with a little politics. I'm going to get to Brexit in a second, but I was at the Democratic Convention on Saturday, and I was at the Jackson-Jefferson dinner Saturday night. I thought Terry McAuliffe stole the show. I thought the guy made a great speech, and look, I'm for Trump, and I don't want Clinton to pick McAuliffe as vice president because I think he'd be your best choice. I think that would be not a good thing for Trump. He made a great speech Saturday, didn't he?
Yeah. Well, actually, I didn't go, John. I didn't. I have to tell you, I was chair of the Democratic Party back in 2012. I've attended Jefferson-Jackson Day dinners and conventions for years. I just, in this position, I've kind of enjoyed just taking a less political role and leaving the politics to others and just doing my job as your secretary. So I actually didn't go, but I've heard the governor gave a great speech both at the convention and then again at the Jefferson-Jackson Day evening address, and he does. I mean, he has a lot to talk about. A 3.8% unemployment rate, that's the most important thing. He's always talked about building the new Virginia economy, attracting jobs, and that's a very bipartisan achievement and goal. And so he's pretty excited. Of course, he's always excited. So
well, he's always excited. He's always animated, but he's become I was just commenting, I followed him obviously for a long time. He's become a very, very effective stump speaker, and he can give quite the speech. I thought he did a very good job on Saturday evening. And look, when people are getting jobs, that's the best thing that could possibly happen. It's all about jobs. I want to get into your area of expertise. I was at a conference where I did my show the last 2 days in Washington, D.C., and I had a chance to get on my show a couple of ranchers from Arizona who are on the southern Arizona-Mexico border, and they were telling me that the drug flow coming into the United States from Mexico has been like unprecedented in the last 6 months. And I spent a week before the New Hampshire primary leading up to it in Manchester, New Hampshire, Mr. Secretary, and the biggest issue is just talking to people in Manchester, just on the street. The number one issue they had was the drug addiction in New Hampshire and the fact that all these drugs are coming in, and the number of people in New Hampshire now addicted to opioids.
Heroin.
What's to heroin? What's the deal?
I have a lot to say about that, actually. Again, very timely, I just attended a conference in Baltimore hosted by the Baltimore-Washington HIDA, which stands for High Intensity Drug Trafficking Area. It's funded by the federal government. It's law enforcement, a drug enforcement agency, and it's HIDA collects all of the local agencies, your state agencies, as well as the federal government, cooperates together to address drugs. And so there's a Baltimore-Washington area, and there's a Appalachian area. They asked me to come and keynote their lunch on Wednesday, and I went, and it was such a great conference. I stayed both days, and all about heroin, opioids, fentanyl. This fentanyl is a synthetic being manufactured in China. It's coming to us directly from China or through Mexico. And the DEA administrator, who I know from our days as prosecutors together 20 years ago, he is now the head of DEA, and had a good chat with him. It is what's happening is, heroin. There's such a demand, and they're growing it. Growing it. It's a cash crop. You can make a lot of money out of it, and it is coming across the border. It's coming through our ports. Baltimore, the Virginia law enforcement will tell you that The heroin coming into Virginia is coming out of the Baltimore. It's coming through their port. It's and the commissioner of the Baltimore police was there. In these efforts, I tell you, it's like whack-a-mole. Though they arrest one drug dealer, somebody else takes it up because there's just so much demand, there's so much money, and so bottom line is how we're addressing this. It's not just a law enforcement. We cannot arrest our way out of it. Meaning, you can arrest all the drug dealers, but if there's so much demand, you're just going to have another drug dealer surface. And so we have to address it both. All of the above: prevention, treatment, recovery, law enforcement, and it's a big issue. We've had over 900 deaths in Virginia, heroin, opioids, and the governor. We actually just the governor signed 4 bills just yesterday, trying to address the opiate prescription aspect of this, where people are doctor shopping, getting multiple prescriptions. The prescriptions are longer than they should be for pain. So there's a whole lot of issues there, John, around this issue. We're trying to do, from all fronts. We're taking this on, from the medical community to the law enforcement community, and it's a real challenge, and we're working on it, but it's a real challenge.
Mr. Secretary, what is driving the demand here for heroin? I mean, we kind of went through this. I think you and I are probably the same age. I'm 58. We kind of went through this in the 60s where there was, all this heroin coming in. And then we had
John, when we were, I'm a very similar age, but heroin, I never had friends doing heroin. There was needles involved for one. Right. I never would have done it personally. Right. It was rock stars. Remember Keith Moon of The Who?
Yeah, right.
Died of a heroin overdose. But now it is it's in our suburbs. This isn't an urban. It's all over Virginia. You can get it in Richmond City, but you can get it in Galax, Virginia. It's a disease that's all over Virginia, rural, urban. Just a horrible thing going on right now, and it just takes over their brain. That you look at the medical science on it, and they'll tell you even one dose you can get addicted, and you just cannot get off the stuff. You go through. We heard from users who multiple interdictions, or interventions where they did recovery, but as soon as they got out, they'd go and find another hit, and if they take a high dose, that's what leads to your overdose and potential death. So it's a horrible disease going on right now.
What is the core of this? I mean, why is this happening? I guess is what I'm trying to figure out. Because like I said, when I was in New Hampshire, I mean, I would have thought the number one issue there, I talked to people in diners, was, jobs or the economy or trade. It was just heroin. It was addiction. It was drugs. What has happened that has got this to seep in the suburbs? Has the price of it gone down? Is it just more readily accessible? Mr. Secretary, what happened?
So I think, you still wonder why someone would take it. And, if you're working, you got a family, and you got to scratch your heads. We heard from a father of a kid who died of an overdose, and, they thought everything was fine. The kid was getting good grades in school, and next thing you know, he winds up on their bedroom floor dead. And it was just a horrible disease, and you wonder what would drive him to that addiction. There's alcohol abuse has always been around, and we've always been combating that. That's still the number one challenge. But this one is just so potent. But so you try to do, have access to varieties of treatments. In the Richmond area here, we have peer-to-peer counseling. I was just in the Chesterfield jail with Sheriff Carl Leonard. He has a tremendous program where you even have jail inmates who were doing this program 5 hours a day. They get counseling. There's one kid that was in there the other day. I spent over an hour with him asking questions, and they were asking him, and it was a really good dialogue. And he said he actually got released 4 days ago from jail, but he keeps coming back to the jail to get the 5 hours of counseling every day because he knows if he doesn't, he's going to relapse. He needs to keep. So access to treatment is important, and access to heroin. I mean, all these inmates, there are over 30 of them. They said they could get it in Chesterfield, they could get it in Richmond with ease. It's easier to get heroin than it would be a prescription drug now, they said.
It's
horrible.
It is horrible, Mr. Secretary. It's unbelievable. And we do our Christmas show, one of our Christmas shows at the Richmond jail with Sheriff Carl Leonard there, where we actually have inmates that come in that are there in their recovery program and, come on the show and talk about, what they've gone through and what their experiences are. And so, we get maybe 20 of them or so on the air throughout the day on our show, and every one of them, you can lead every one of them that's in there. You can trace their crime and how they got there back to drugs. Every single one.
Right.
It's 100%.
That's why, when the governor created a task force, we got task forces for everything, and you really need to do that because you need stakeholders around the table. And the governor appointed me, but then appointed our Secretary of Health and Human Resources, Bill Hazel, because immediately this isn't just a law enforcement problem. This thing is a healthcare problem, particularly around, heroin's illegal substance. Obviously, we're going to have interdictions. We're going to work with our DEA and our federal forces and the state police and task forces to find the drug dealers. But the opiate issue is equally as important because a lot of these guys will tell you they started with opiates. In fact, 80% of the cases they're dealing with overdoses, they started with an opiate. Okay, so we're looking at, hey, why does America use so many opiates? Listen to this, John. Over 99% of all the world's hydrocodone is consumed by Americans. The world's supply of hydrocodone, 99% of it America. 80% of the OxyContin. We have 5% of the world's population, yet over 80% of the OxyContin, 99% of hydrocodone. So let's just, why is that? Why is Americans, I think it has a lot to do with, we got to work with our medical community. One of the inmates I talked to Tuesday in Chesterfield, he said he had a foot pain and he received 180 Dilaudid, 180 pills Dilaudid. So yesterday's legislation that the governor signed, one of them says, hey, anything over 7-day prescription of opiates is mandatorily reported in this prescription drug monitoring, prescription monitoring program, so that we have that information. So, anything over 7 days, what you're doing is creating addicts with over prescribing, and then they're addicted. They get off the prescription, and then they go to the heroin because the heroin is so cheap and accessible, and they end up with heroin. And next thing you know, they're in the criminal justice system. And a lot of this with veterans, John. We heard from veterans, they come back with PTSD and they're self-medicating. They start with opiates and then they end up with the heroin. It's just, it's just tragic. And so it really takes a whole community approach. This is medical community, law enforcement, treatment providers to try to get these individuals into appropriate recovery programs.
Well, I tell you what, Mr. Secretary, we're almost out of time, but we need to continue this discussion again next week because
unfortunately, it's not going away.
That's it.
What the DEA was telling us, we're not even at the crest here. This thing is still, the trajectory is going up in terms of deaths and overdoses. Now, there are Narcan. We've provided Narcan to law enforcement and EMS so that they can revive these individuals when they encounter an overdose to save a life. But it's a multiple-pronged approach that we need to take to this. Activities are occurring, and your listeners should know it's all hands on deck, but it's going to take the entire community.
All right. Well, the one thing that I heard you say that I'm going to end with is you said we cannot arrest our way out of this mess. And I think that's something we want to continue on next week. I'm out of time for now, though. I want to thank Secretary of Public Safety and Homeland Security, Brian Moran, for being with us fighting drugs in Virginia. Hey, Mr. Secretary, thanks for being with us. Have a super weekend. Thank you so much.